Greetings everyone, it's great to have you back on CamIn Medicine. Today we're taking a deep dive into a common yet discomforting issue, sinus infections. If you've ever experienced that relentless pain in your face or forehead, you'd agree that it's far from pleasant. However, understanding its causes can pave the way for effective relief. So, don't forget to subscribe and turn on notifications, ensuring you never miss our health and wellness updates. Now, without further ado, we'll delve into the causes of sinus infections. Sinus infections, medically known as sinusitis, aren't a mystery. They are quite common and can affect anyone, irrespective of age or health status. But what causes these pesky infections that can make our lives so uncomfortable? Let's delve into that. First up is the common cold. Now you might be wondering, how does a simple cold lead to a sinus infection? Well, when you catch a cold, your body responds by producing more mucus than usual. This extra mucus can block your sinuses, creating a perfect breeding ground for bacteria and viruses, which can lead to an infection. Next, we have allergies. Allergies, much like colds, cause your body to produce extra mucus. But they also cause swelling in the lining of your nose and sinuses. This combination of extra mucus and swelling can again block your sinuses, leading to an infection. Common allergens that can trigger this response include dust mites, pet dander, pollen, and mold. Lastly, let's talk about nasal polyps. These are small, benign growths that can form in the lining of your sinuses or nose. While they're not harmful in themselves, they can block the sinus passages, preventing mucus from draining properly. This stagnant mucus can then become a hotbed for bacteria, leading to an infection. Each of these causes, colds, allergies, and nasal polyps, share a common thread. They all lead to inflammation and blockage in the sinuses. When your sinuses are blocked, mucus can't drain properly. This creates a damp, dark environment that bacteria and viruses love. And when these microbes multiply, they can lead to an infection, giving you the throbbing pain and discomfort associated with sinusitis. Understanding these causes is the first step towards relief. Next, we'll look at the symptoms of a sinus infection. Sinus infections come with a host of symptoms that can put a damper on your day. These symptoms can range from mild to severe and can last for several days or even weeks if left untreated. So what exactly should you look out for? Firstly, facial pain and pressure are often key indicators of a sinus infection. This discomfort is typically located around the forehead, cheeks, and eyes, and can intensify when bending over or lying down. It's not just a dull ache, but a persistent throbbing sensation that can make even simple tasks feel challenging. Next, let's talk about nasal congestion. This is more than just your run-of-the-mill stuffy nose. When you have a sinus infection, the inflammation can cause your nasal passages to swell, making it difficult to breathe through your nose. It's as if you're constantly underwater, gasping for air. Then, there's the postnasal drip. This is when excess mucus drips down the back of your throat, causing a persistent cough, sore throat, or even a hoarse voice. It's not just uncomfortable, but also quite disruptive, especially when you're trying to have a conversation or get a good night's sleep. Another common symptom is a reduced sense of smell and taste. This is because the inflammation and mucus buildup can block your olfactory receptors, which are responsible for detecting scents. So your favorite foods might suddenly seem bland, or you might find it difficult to pick up on certain smells. Finally, you might also experience fatigue, tooth pain, and even a slight fever. These symptoms are your body's way of telling you that it's fighting off an infection, so don't ignore them. Remember, the severity and duration of these symptoms can vary greatly from person to person. Some might experience all of these symptoms while others might only have a few. Either way, it's important to listen to your body and take care of yourself. Identifying these symptoms early can help you manage your sinus infection better. Now let's move on to some home remedies. While sinus infections can be a pain, there are ways to find relief at home. Simple yet effective strategies can help ease your discomfort and speed up your recovery. First off, hydration is key. Drinking plenty of fluids, especially water, can thin out that thick mucus, relieving sinus pressure and congestion. Next, consider using a humidifier in your living space. Dry air can aggravate your sinuses, but a humidifier adds moisture back into the air, helping to soothe your inflamed nasal passages. And don't forget about applying warm compresses to your face. This old-school remedy can provide immediate relief by reducing pain and pressure. Nasal irrigation. Another great option is nasal irrigation using a saline solution. This helps flush out mucus and irritants from your nasal passages, providing much-needed relief. Hydration and rest. Don't underestimate the power of staying hydrated and getting enough rest. Drinking plenty of fluids helps thin mucus, making it easier to expel. And of course, rest allows your body to focus on healing. However, while these home remedies can provide temporary relief, they are not a cure-all. If your sinus infection symptoms persist beyond a week, or if they worsen, it's crucial to seek professional help. Chronic or severe sinus infections may require more advanced treatments such as prescription medications or even surgery in some cases. It's also important to remember that what works for one person may not work for another. We all have unique bodies, and what soothes one person's sinus infection might not do the trick for someone else. So don't hesitate to reach out to your healthcare provider if you're struggling with a sinus infection. They can guide you towards the most effective treatment options for your specific situation. Remember, if your symptoms don't improve or get worse, it's time to consult a healthcare professional. We've covered a lot today about sinus infections, their causes, symptoms, and some relief strategies. We dove deep into the various factors that can lead to these uncomfortable and often painful infections, from common colds to allergies and even structural issues in the nasal cavity. We also shed light on the symptoms to look out for. Remember, it's not just about a stuffy nose or a headache. There can be facial pain, pressure, and even a reduced sense of smell. We spoke about home remedies that can offer some relief, like warm compresses and steam inhalation, but we also emphasized the importance of seeking professional help when symptoms persist or worsen. In understanding what's happening in our bodies during a sinus infection, we can better manage the condition and seek timely help. Thank you for watching, and remember to take care of your health. Till next time, stay healthy and safe.